start the stream? Sure do. Let's double check up here that we are going live. Okay, I think we're live. Welcome everybody to the Medicare Cafe. Happy to have you on here today. Now I know some of you got on and immediately were disappointed because you saw me and not Olivia, but sorry suckers, I'm here. Olivia is off on important business as she normally is, and so she wasn't able to make it here today. But you guys have me here hosting the real star of the show, Chaylin Jackson.
Hello, hello.
Woo! I wish I had one of those buttons that was like, yeah.
That's what we need for the zero laugh track.
Yeah, no, we really do. Honestly, in production, we've been looking at it. But really the main thing is we don't trust Olivia with buttons like that. So yeah. We have yet to come up with a solution for that. But yes, everyone, welcome to the Medicare Cafe. Happy to have you here today. Today, we are going to be chit-chatting, we're going to be chit-chatting with Chaylin Jackson on the CapCon highlights. In just a minute, he'll explain a little bit what CapCon is in case you are not aware. But Chaylin, I want to introduce you just a little bit because you're quite an impressive person, and we are very lucky to have you here in our office. I also had to write it down because this dude has a million titles. So, Chaylin Jackson, he is the SMS compliance officer, which alone is already a huge help, but he has done so well at that job as well. He is a key accounts, sits on the key accounts team here as well, helps some of our top producing agents. And, but because he's done such a great job here, he is often invited to a lot of roundtables talking about legislative things and compliance things and all the important things that really smart people need to look over and then tell people, what does this mean? And there's a lot of that happens in this industry. So he is also the president of the Missouri NABIP. So his resume goes on for a long time, and I'm really glad that I said most of that without my notes. So we'll throw that to the side. Chaylin, explain to us before we dive into it, what exactly is CapCon?
So CapCon is the annual conference that NABIP, the National Association of Benefits and Insurance Professionals, hosts every year in Washington, D.C., just as an opportunity to get folks together and talk about what's going on in the industry, changes we would like to see made, any legislation that is pending or sitting before Congress, and what we can do about it. And kind of culminates in a day going to Capitol Hill, reviewing talking points with our legislators, meeting with key committees and other folks on Capitol Hill to try to push forward legislative and regulatory actions that will benefit our industry and the clients that we serve.
So is this sort of stuff, this might be a rookie question, but it'd be like that. Is this stuff that is going to could possibly affect us in multiple years? Or is this something that you're dealing with issues that are affecting us now? Or like, what's kind of like the timeline, like the outlook on that?
Yes, all of that. So it kind of depends, right? We have a lot going on in the industry any given year. We have, last year we saw massive shifts in the industry due to the Inflation Reduction Act, which is a great example of that multi-year impact.
For sure.
Passed way back in 22, 23, and we've seen the impacts every year up to now, and we'll continue to see that impact for the next 10 years.
Yeah.
So a lot of these acts of legislation have far-reaching and long-standing implications for the industry and what's going to happen to us and our clients and our business. Sometimes it's something a little more short and to the point, maybe a regulation to make a change to, for example, when CMS brought back the 48-hour scope rule, that was kind of a one and done. It happened. They made the change. They implemented the rule. But a lot of these things come in phases and in waves. So just like the Inflation Reduction Act, it was phased in over a period of time. A lot of legislation takes some time just to work out the details of how to actually implement it. And that's one of the big problems in DC is you've got legislators that are really kind of, I would describe them as generalists. A legislator's job is to know the people in their district, the people in their state, and kind of how they want to live their lives, what they want to do, and then legislate based on those priorities. But when they create a piece of legislation, that doesn't mean they know the details of how to actually accomplish that goal. And that's where the federal agencies step in, the CMS, the FDA, the USDA, HHS, all of those. they're then responsible for taking that piece of legislation and going, okay, how do we actually do this?
Yeah. Awesome. Cool. Well, I asked Chaylin yesterday of all the things that you talked about at CapCon, and clearly there's a lot of things that were talked about at CapCon. Could you narrow it down to just a few highlights that we can talk about here today? And he did. So let's go ahead and get into the first one.
This is probably the one I'm most excited about, which is why I made the first slide.
Sure.
So, as a member of NABIP's Medicare Advisory Group, I work with other brokers around the country that are in the Medicare space to help direct NABIP's Medicare policy agenda. So, what are the issues facing Medicare, Medicare agents, Medicare beneficiaries that NABIP wants to focus on? And of course, the past 2 or 3 years, one of the big challenges has been kind of honestly just the reputation and the image of agents and brokers in the marketplace.
Totally.
We've seen so much pressure on agents and brokers from a regulatory standpoint, from a carrier standpoint, just even in the news. So we said, what can we do to combat that? And that's where the Brokers Making a Difference campaign was born, was there in the Medicare Advisory Group. We spent a lot of time looking at how can we show the value of an agent and broker to members of Congress, to regulatory agencies. And we said, well, let's speak in the only language they understand, and that's in stories from their constituents. When you go to the Hill, we talk a lot about clients. We talk a lot about Medicare beneficiaries. When you're talking to a legislator, a state rep, or a senator, the only language they understand is constituent and voter.
Yeah.
And so that's the language we have to speak in.
Totally.
So that's what we did. We sent out a very brief 3-question survey to all NABIP members and said, share this with your clients. There was some really brief questions about what is your experience as a client with Medicare? How do you choose a plan? How does a broker factor into that plan? What would you like to say about your experience working with an agent or broker? And as an association, we sent that out to thousands and thousands of Medicare beneficiaries and clients, and we got over 12,000 responses back in just the first couple months of running these surveys. So that was a gargantuan effort to tell the story of the client in their own words about how an agent and broker impacts their ability to access health care. So we were able to take those stories, catalog all of them, sort them out, and every NABIP member that went to Capitol Hill to meet with the legislature went there with a folio that contained stories from people in their state about how a broker has impacted their ability to get health insurance, to access health care. So that was a really great thing we were able to do. We were able to tell real client stories, constituent stories in the state that someone was located in to those legislators when we went to the Hill.
Sick. Awesome. Okay, Alex is telling me, my producer's telling me that we need to turn you up, but it might be helpful if you just pull it forward. I know this is kind of a weird setup to get used to.
No, it's just a little different, but I like it.
Unfortunately, I'm an egomaniac, so I'm like, everybody must hear me at all times. I have no problem being right in front of the mic at all times, but let's take a look. This next highlight here, priorities on the Hill.
Yeah, so it's always interesting when you go to Capitol Hill because obviously we go there as NABIP members, as folks in the Medicare industry, and and NABIP is not just Medicare, it's ACA, it's group insurance. So we have a variety of talking points, but depending on what happens to be going on in Washington, D.C., the priorities of the day don't always match ours. So we have to adjust the message a little bit sometimes.
Yeah.
While we were in D.C. last week, as many people saw in the news, the House passed the budget referendum. So we were there on Capitol Hill on Tuesday in the afternoon talking to legislators about some of our priorities through NABIP, and every office you went into had the budget debate on C-SPAN in the office. So we got to watch bits and pieces as we went from office to office. But it was great. It was great to see the legislation in action, see the debate between the legislators as they worked on this budget, and then of course that night they did end up passing the budget on those razor thin margins. But when we were in those offices, we were talking a lot about some of the same issues we've been discussing for years. Things like COBRA as creditable coverage for Medicare Part B, issues like Part D and adding it to the open enrollment period period that's going on right now, that one-time chance to make a standalone Part D plan change.
Yeah.
And then also issues like ensuring the continued tax credits for small businesses that want to offer health insurance.
Mm.
So making sure that it's still advantageous to a business owner to offer that health insurance coverage. And then, of course, talking a little bit about that role of agents and brokers, the compensations issues that agents and brokers have faced, and how what we do provides so much value to those constituents, to those beneficiaries, especially in the face of so many people needing help this past year
Right.
with all of the plan exits, all of the benefit changes,
Yeah.
and the resources we have through the federal government just simply would not be able to manage that workload. So
Mhm.
agents and brokers are not just a huge value add at a very low cost for the federal government, but also incredibly necessary to make sure everyone can access that reasoned, trained, certified advice on how to select a plan.
Right. Yeah, exactly. And then let's see. Let me look back here. This is why they never had me run the slides. Tax cuts, NABIP talking points, all that sorts of stuff. And then birthday rules. This is
Yeah.
interesting. Yeah.
So this is more state by state. So not so much a federal issue, but definitely came up a lot as I was talking to other NABIP members from around the country while I was in DC, talking a lot about birthday and anniversary rules. Obviously, we've got some great white papers on, the 14 or 15 states that have those right now, but there's like 12 states that are looking at adding to, amending, or creating new birthday and anniversary rules.
Yeah.
I'll call them expanded guaranteed issue because they all function a little bit differently, but
Right.
at the end of the day, many of them are a birthday type rule. So it was a lot of discussion of, are these actually a good idea? Do they actually benefit Medicare beneficiaries? Do they actually provide a value that is better than their cost? And it's a heated debate because what we know for a fact, and the state of Minnesota actually passed a birthday rule type piece of legislation in 2023. They immediately commissioned a study after passing it. I would have done that before passing it.
Yeah.
But,
Right.
you win some, you lose some.
Right.
So they commissioned this study, and they hired an outside firm to do it, and it painted a pretty grim picture, frankly. And I think this is something that a lot of us know anecdotally. We now have good data to back it up through our partners at CSG. But what we know is when states adopt a birthday or anniversary type rule, some kind of expanded guaranteed issue, premiums go up, choice goes down. And for agents and brokers, it becomes increasingly difficult to find a plan that'll actually pay you a commission for the work that you're doing.
Right.
And it's not an insignificant amount. On average, if you look at states that have these types of rules over, that first 10 years or so, the number of plan options in a state that has expanded GI compared to a state that does not reduces up to 60%. So 60% fewer available plans, and then premiums are as much as 50% higher than in those non-GI states. So while it is seen as an easy win for consumers because it gives you that idea that we have more choices, we can make changes, we can shop rates every couple years if we want, it actually tends to raise premiums, reduce choices, and in the long term, destabilizes that med sup market in a lot of states.
Yeah, totally. Do you feel like this year there was more? Is it kind of always half and half of like some med sup talk, some MA talk, some Part D talk? Or do you feel like this year was heavier on one side or the other?
Yeah, so I think it depends on where you're talking about. So like in DC at the federal level, it's always MA and Part D.
Totally. Right.
Just because that's where it's regulated.
Right.
So, but this year, I will say by far, we've seen an uptick. We had like 7 or 8 states that had some kind of birthday or anniversary rule, but they've had them forever. Like
Right.
Missouri, like California, like Washington State. And then the past 5 years, you've seen more states add those. Idaho, Oklahoma, Illinois, some of these others. And that has just ramped up dramatically. So to see, 9 or 12 new states this year talking about potentially adding some kind of expanded GI or amending what they already have, that's a huge uptick. And I think it's hard not to look at that as a lot of states that are very frustrated with a system that they have limited control over. You've got a lot of state legislatures, a lot of state insurance commissioners that look at Medicare as this behemoth that's kind of far and away. It's managed in D.C. It's the problem of the federal regulators.
Yeah.
So there's a limited amount they can do, but one of the things they can do is manage how Medicare supplements are sold in their state.
Right.
So if you're sitting around and you're looking for something to do, something to tell your constituents that you're working for them,
Mm-hmm.
and that's the only nail you can hit, you're going to go after it.
Yeah, absolutely. Before we wrap up here, I do have a question on, well, one,
course.
is there like anything else overall? I know we kind of like sped through some of this stuff, but is there anything else, any other takeaways that might have been like random, didn't fit in the slides, or like whatever
Yeah.
it may be? Was there anything else? Do you feel like the overall I don't know what, like, I guess the overall like energy is there, the vibe or anything like that, but do people feel excited about some of the changes are coming up? Do you feel, I don't know.
Yeah, no. So I think that's great because Capital Conference is, and I tell people this constantly, is my favorite conference I go to every year. If I
Yeah.
had to pick one, if I could only go to one, it would probably be Capital
Capcom,
Conference.
yeah.
It would be. The energy in that room is just so great.
Yeah.
You've got, this year we had over 700 people in attendance, which is an uptick from the past couple years. And more importantly, over 200 first-time attendees. So that was
Wow.
fantastic to
Yeah.
see, so many people for the first time getting to the Hill, getting out there that they've never done a Hill visit before. Maybe they've never talked to one of their legislators. And for a lot of people that can be pretty intimidating. But we had a lot of folks that showed up to do the work, to get out there and share the message that agents and brokers are here to stay. They provide a lot of value, and we intend to keep doing that.
Yeah.
So I think the energy was very very positive this year. I mean, it's not every year,
Right,
It's
right.
There's
Yeah.
a lot of challenges.
Exactly.
For sure. So I think this year it was really nice to see a lot of folks that were very excited to be there, excited about our message,
Mhm.
excited that we had those real client, constituent, beneficiary stories to
Yeah.
share with our legislators.
Yeah.
And I think it was just reassuring to a lot of brokers to say, listen, we do have a place here. We do have a seat at the table to
Yeah.
talk about what's going on back home
Yes.
with the folks that these representatives, these senators are supposed to be representing. So
Right.
it's I think for a lot of folks it's a very empowering experience because
Yeah,
it's a
absolutely.
voice they maybe didn't realize they had.
Right. Yes. And I mean, that's why organizations like NABIP are so important, is like, if it's a way for you to get involved, it is a way, even on like the smaller levels. Like if you join like your local, do you call them
Absolutely.
chapters?
Yep,
Your local
local chapter.
chapters. Yeah. You're able to have a voice. And so can you tell people how, if they want to get involved with NABIP, if they want to learn more information, how they can do so?
Of course, yeah. nabip.org. Find your local chapter on that homepage. So nabip.org. And just find a chapter. Find a local chapter. There's chapters in all 50 states. Some of them meet virtually. Some of them meet in person. Here in Missouri, we've got 3 chapters in St. Louis, Central Missouri, and Southwest Missouri. Don't ask me why, but Kansas City falls under the Kansas chapters. Listen,
Oh my gosh.
it's fine.
Okay.
It's fine. They're good people.
I'm going to be joining NABIP just to be like, I have something to say.
Yeah, but it's a great organization. Most chapters meet monthly, offer a variety of CE credits and social activities. Many chapters participate in local or regional charities, and then of course you've got our national events like Capital Conference, and then it's not too late to sign up for the annual convention in Miami at the end of June. So
Oh, yeah.
that will also be a lot of fun. But
Cool.
if you want to get together once a month or more often with excited and active and passionate agents across all parts of the insurance industry, the health and benefits industry, NABIP is a great way to get involved in that process.
Awesome. Love it. Okay, cool. Let's wrap up here a little early. We did honestly very good on time. I'm very impressed with us. Chaylin, do you have anything else to add? If anybody wants to get a hold of you for whatever reason, call our office,
Yeah.
800.
Call the office, reach out to me on LinkedIn, whatever makes the most sense for you.
Yeah.
I'm always around.
Absolutely. Cool. Well, everyone, that's what we have for you today. Of course, if you ever have any compliance things, where is my mouse? You can find us smsteam.net on Facebook. Ooh, yes, I'm supposed to plug that page.
Yeah, there you
On
go.
Facebook, if you want to continue this conversation, please join our Facebook group. We have a page and we also have a group. The group is a nice safe space in the industry to ask some questions, get some advice from other people who are out there doing the exact same thing as you. And yeah, just get some feedback. So join us there. But for now, have fun.
Am I supposed
Make
to
money.
finish?
Well, I
Make
didn't
money?
go